Every puff of cigarette smoke leads you closer to severe health issues. According to a study from the union.org, 17.3 million adults, or 28% of the Philippine population, uses tobacco. And 55% of youth from ages 13 to 15 and 40% of adults are exposed to secondhand smoke in their homes. So, how can someone quit smoking? Today on the show, we'll discuss smoking addiction and how to manage it before it's too late. I'm Dr. Freddy Gomez, and welcome to MedTalk Health Talk, only on CNN Philippines. Our guests are here today to give insights on smoking addiction. With us is Dr. Edgardo Tolentino. He's an addiction psychiatrist from the Makati Medical Center. We're also joined by Dr. Lorenzo Mata. He's an occupational medicine specialist and president of the advocacy group Quit for Good. Thank you both for joining us on the program today. Now, we all know that a lot of Filipinos smoke. That's why this episode is for them, why we smoke, and possible alternatives for that. So I'll start the discussion first with Dr. Lawrence. Doc, could you share with us why smoking is so prevalent dito sa atin sa Pilipinas?
Smoking is really prevalent in the Philippines because one reason for that is poverty. That's why we have the most number of smokers in the Philippines belong to the lower income group.
So accessibility is a big factor here on why smoking is so prevalent here in the Philippines. But Dr. Ed, is it possible, is it a fair question to ask why people smoke?
I'll take it from Lawrence. From the social, let's move to the individual.
Mhm.
Put it this way, very simply, smoking is pleasurable. That's one. Second, smoking is also a sort of a rite of passage. So pretty much all of us will try it somehow, some way. Others will probably find it so pleasurable that they'll stick to it. I think there are multiple factors why people will actually start, will actually stay on it, and will actually go back even if they have stopped sometimes for 10 years or so.
Now, Dr. Ed, does age pose a significant factor here for those who start smoking and those who continue to smoke?
Definitely, for initiating factors, it's usually the young. And therefore, they are the most vulnerable to the lure.
According to a survey commissioned by a local consumer advocacy group, 88% or nearly 9 out of 10 adult Filipino smokers would consider switching to smoke-free alternatives such as electronic cigarettes and heated tobacco products. Now let's talk about that, Dr. Lawrence. Is there a difference between smoking, let's say, a cigar, smoking a cigarette, as well as vaping? Is one less harmful than the other?
So there's a big difference between smoking cigarette and vaping and heated tobacco products. Smoking delivers nicotine by burning tobacco, which causes all the smoking related diseases that we all know now. And vaping or heated tobacco products deliver nicotine by heating e-liquid up only to the point of vaporization. So it's, according to Public Health England, it's about 90 to 95% less harmful than smoking cigarette.
Let's make it very clear that even while e-cigarettes may be, let's say, a safer alternative, less harmful doesn't really mean it's totally safe. Actually, around 30+% will actually end up using cigarettes again if they haven't, or if they used to do that, they'll go back to cigarettes because of its powerful and rewarding effect of nicotine.
Now, Dr. Lawrence, let's talk about some of the components of a cigarette. Dr. Ed talked about there are several harmful things. When it comes to combustion byproducts from a cigarette, is it significantly less found in electronic cigarettes or heated tobacco products for that matter?
Yes, Freddy, that's true. And we are not saying that the vaporized nicotine products or the heated tobacco products are harmless. No? They still have harm in them. But there is a big difference in regards to harm because of the combustion involved in cigarette smoking. So, cigarette smoke contains about 7,000 chemicals, and at least about 250 of those chemicals are harmful. Those harmful chemicals there present, 69 of them are carcinogenic. So, it's cancer-causing chemicals. Nicotine, on the other hand, is relatively benign without the smoke. It's a very addictive substance.
Dr. Ed, pag-usapan naman natin yung nicotine. We've been talking about it as the common ingredient in all. What is nicotine? What does it do to our body?
To simplify things, all of the addictive substances will eventually come into the crossroads of the brain chemical called dopamine. And dopamine is our pleasure brain chemical. The thing about it is when you make it hit, dopamine actually spikes in proportions that are more than what we get out of the pleasure of, say, eating. However, to sustain that, you need to do it over and over and over again. And therefore, after a while, you want to attain that again. And that's the reason why a lot of people would smoke when they're anxious, when they're stressed, when they're depressed, to have that pleasurable feeling once more. The thing though is you will have certain phenomenon. One is tolerance. After a while, your usual dose isn't gonna work and you need to push it further. So your 1 becomes 2, your 2 becomes 4, and so on and so forth. The second is if you wanna stop, there's such a phenomenon called withdrawal. So you wanna stop, but you become irritable, you become shaky, you become anxious.
So that's very interesting, and we'll talk about what are some of the effects of that phenomenon when we return. So we're your partner in healthcare. We'll be right back. I'm Dr. Freddy Gomez, and welcome back to Med Talk Health Talk, where caring is our calling. We're talking about how to safely, or better yet, quit smoking cigarettes. Now, everyone, or at least a lot of people, is well aware of some of the bad effects of smoking cigarettes. Dr. Lawrence, when it comes to trying to advocate quitting altogether, is it difficult for someone who's been addicted to smoking for several years, to quit cold turkey?
Yes, according to experiences, it's really very difficult for them to do that. That's why the quitting rate is only 4%, because it's really very difficult. Even if they attempt to quit now and successfully do it for some time, the relapse is very high.
Dr. Ed, the best way to quit is quit cold turkey now. But is it that easy?
Not that easy at all. Let's put it in numbers. Someone who wants to quit on their own, period, okay, just decides. Success rate, 1%. If you add, let's say, a doctor's advice, it goes up to about around 5%. If we add, let's say, nicotine replacement therapy, which is using gums, using patches, using nasal sprays, that goes up to closer to about 10 to 13%. Now, with medications now, there's bupropion. Unfortunately, we don't have that anymore in the Philippines. We used to have that. Then we go up to as much as 30 to 40%.
Now we want them to have a better alternative to cigarettes. Is still having nicotine, Ed, in that tools for transitioning them, is that an important factor to still have nicotine in there?
In our assessment tool, and we usually make use of the Fagerstrom scale, it actually will correspond to what kind of treatments might be available. Now, if we're talking mild up to at least moderate, nicotine replacement therapy may have a role. And it also will lessen some of the effects of secondhand smoke, of course. But what I'd like to mention is that we should not just focus on the biological way of dealing it with smoking cessation, because the reality is the most successful approaches would incorporate a more comprehensive approach. So it's not just biological. In fact, before you even start the biological approaches, including medications, you actually start with some of the behavioral approaches so that, from the get-go, we try to assure especially somebody who is willing to quit now, that they will succeed.
Dr. Lawrence, though, when it comes to trying to stop someone from smoking altogether, our main goal here is to put them in a healthier place because it is already established that cigarettes have all of these harmful chemicals to them. If someone would like to have a better chance of transitioning away from cigarettes and look at alternatives to cigarettes, heated tobacco products, vape cigarettes, could you safely say that they are going towards the right direction? Or is it just coming out of the pan and into the fire sort of situation?
Okay, Freddy, let me make this clear. Okay? The best way to stop smoking really is to quit cold turkey. That's the number one. Now, if they cannot do away with cold turkey, then we offer them the nicotine replacement therapies, which are available over the counter actually. No? Now, as Dr. Ed has mentioned, we have drugs to help us. Now, it's not only one treatment that you give, an RT or drug. It's a combination of all, including behavioral therapy. We have to bring this all together. Now, it cannot do anything about it. Then the next best thing is to look for another alternative. That's why there's a term as harm reduction, because we are trying to reduce the harm of this harmful substance from the great harm to a lesser harm. We are not telling that this is safe. No, it's not. And we are not even advocating this for those who are not smokers.
That's a very interesting point, Dr. Lawrence, especially when it comes, because ideally is quitting cold turkey, but as what Dr. Ed mentioned, 1%. So there's a big majority who will fail, who will definitely fail with cold turkey. So what we're trying to find here is a good alternative, a step towards that right direction. And we will give you those steps. When we return, we'll provide you with ways to help someone quit their smoking addiction. But don't quit on us. Med Talk Health Talk will be right back. Welcome back to Med Talk Health Talk. Now, taking the right steps for your health when quitting cigarette smoking means taking the right medical choices. Now, Dr. Ed, pag-usapan naman natin yon. So if someone is to be successful in quitting smoking, is it enough that their loved ones around them make them quit? Or is all of it dependent on that person itself? Kailangan ready nang mag-quit yung tao?
Ang approach namin as addiction psychiatrists, we actually find first the readiness to quit, and we go through the stages of change. There's the stage of pre-contemplation where nowhere in their universe do they intend to quit. At best, ang intervention dito is just, engaging them. So, puro education lang. Hindi tayo nagpo-force ng issue. Then there's contemplation. They are already sitting on the fence. Maybe I should, maybe I shouldn't. So, this is the time we actually engage them in asking what is still keeping you from not, etc. What would you see as your benefits, etc. And then they go into preparation. In the preparation stage, they start asking. And this is where we're aiming at, to the point that they slowly internalize it. It's not them, but it's me. So in the preparation stage, they start asking until it becomes totally internal. And this is when on their own, okay, we're all ready to support, but on their own, they are going to stop. With this approach, mas tumataas yung ating success rate because it's already internally driven.
That's a very good explanation of that, and that's where we want those who are smoking cigarettes now to go to or go towards being able to realize that it is better to be quitting their cigarette smoking. But for those who are not yet ready, which is going to be a lot of Filipinos who are not yet ready. Dr. Lawrence, they are smoking cigarettes now. They're not yet ready to quit. Ayaw pa nila. What are some of alternatives to cigarette smoking?
Okay, we can offer them the vaporized nicotine products and the heated tobacco products, which does not involve combustion. And this is on the basis of harm reduction principle. Okay, we are reducing the greater harm and offering them a less harmful alternative.
Yes, that's a less harmful alternative is definitely there, but we have to address some of the concerns for those, especially those who hear a lot in the news about these alternatives to cigarette smoking. A lot are saying na halos walang pinagkaiba from cigarettes. What could be some of the reasons for this, Dr. Lawrence?
Well, of course, they should get the right information from the right sources. The problem here is there are exaggerated claims. This does this, this does that, and you know very well that the vaporized nicotine products now is we are basing it on science. Okay, we are not basing it on other things. We know the chromatography studies of the vapor and the chromatography studies of the smoke and how different it is from the smoke. So chemical wise, yes, they still generate chemicals with the vapor, but the amount of chemicals and the harmful chemicals in the smoke is so much higher than the vapor.
Now we've learned really a lot, definitely here. We'd like to close this off by asking if you have any messages for our viewers. I'll start first with Dr. Ed. Do you have any message for our viewers, especially those who are smokers, who are thinking about quitting, not so sure? How can they get some help?
Bottom line is that anytime you're ready to stop smoking is a good time. So I always want to bring it back to the individual. After all the efforts from public education, from work, from school, etc., it all ends with the individual. And anytime you're ready, you will reap the benefits of quitting smoking.
Okay, very good. And Dr. Lawrence, any message for our viewers?
We have to inform very well our public that cigarette smoking is the world's leading cause of preventable death and diseases. It's causing about 8 million deaths per year. Okay, and 1.2 million of those numbers are due to secondhand smoke. Okay. In the Philippines alone, we have 117,000 deaths due to smoking-related diseases per year. That is practically 10 people dying every hour due to smoking-related diseases. This is an epidemic of big proportion. No? So we should be really serious about it and do it with exigency. No? And the things that we have to do to prevent this from happening is with utmost emergency.
And with that, thank you so much, Dr. Ed Tolentino and Dr. Lawrence Mata, for being with us today, sharing your expertise about smoking addiction. I'm Dr. Freddy Gomez, and thank you for watching MedTalk Health Talk. We'll see you again next time.